I'm a behavioral health therapist with the Children, Youth, and Families Division for the state of New Mexico, and I work in the Juvenile Justice Services. I'm a unit therapist at one of the juvenile correctional facilities in Albuquerque, which means that I work on a unit with kids who have been adjudicated or are currently incarcerated from anywhere from 1 year all the way up to the age of 21. I spent roughly well over 20 years as a computer engineer. And then in 2008, I had a series of pretty major life events. It started with my father passing away very suddenly in September of 2008, and then a couple of other major life events. And so I decided I wanted to do something different. I didn't know what. So I met with a friend of mine who's a priest, and we sat down and we talked about it, and he said, well, tell me about your life. Throughout a major part of my life, I've done volunteer work. I've done hospice volunteer work, Special Olympics, and those sorts of things. And so he just sort of all of a sudden looked at me and said, well, it sounds to me like you should go into the helping professions, which had never occurred to me. And the idea kind of caught hold, and I called my sister, who's a social worker, and she's a little older than me, and she said, well, why not? Why don't you? And then my mother, I think they ganged up on me, really what they did. I think they conspired. So my mother said, so I hear you think about doing a doctorate. And I said, well, no, not really. And she said, well, I think you should. And I'm like, well, yeah, but they're kind of expensive. And she said, well, I'll pay for it. So they really started tearing down all the excuses that I may have had, But I didn't know what I wanted to do with a doctorate, or in a doctorate program. The woman who's now my wife, we were interning together. She went to a conference in New Orleans. There was a table there talking about the DBH program, and so she brought a folder back to me, and I opened it and started looking at it, and it just made sense. It made sense to me. And I'd already had Dr. Janet Cummings in a class, and I really enjoyed, the feedback was just amazing. And again, I reached out to my sister, and I said, there's kind of a quandary here. I'm not sure what to do. And I don't know if this is an exact quote, but it's pretty close to it. And she said, I would stick with the people who created the program. And it's like, yeah, why didn't I think of that?